Typhoid fever is a serious illness that can affect anyone, regardless of age or background. It spreads through contaminated food and water, often in areas where clean water is scarce. This disease affects millions globally, especially in densely populated regions with inadequate sanitation and hygiene practices. Typhoid fever can be fatal if not treated promptly, leading to severe complications and even death. The bacteria responsible for typhoid fever, Salmonella typhi, live in the intestines and bloodstream of infected individuals. These bacteria are shed in feces, making proper sanitation and hygiene crucial for preventing transmission. Symptoms can range from mild to severe, including high fever, headache, and abdominal pain, often making it difficult to diagnose early. The impact of typhoid fever extends beyond individual health, affecting families and communities. It can cripple economies due to lost productivity, increased healthcare costs, and strain on healthcare systems. Therefore, understanding this disease and implementing effective control measures, such as vaccination and improved sanitation, are essential for global health security and the well-being of future generations. Typhoid fever is caused by a specific type of bacteria called. This bacterium thrives in contaminated environments and spreads through the fecal-oral route. This means that contaminated food, water, or hands can transmit the bacteria, is highly adaptable, and can survive for weeks in water or sewage. This resilience makes it a persistent threat, especially in areas with limited access to clean water and sanitation. Closely related bacteria cause paratyphoid fever. While similar in transmission and some symptoms, paratyphoid fever is generally milder than typhoid fever. Typhoid and paratyphoid fevers share similarities but differ in severity and geographical distribution. While both are caused by bacteria, they are distinct diseases. Typhoid fever caused by is typically more severe. It can lead to life-threatening complications if left untreated. Paratyphoid fever caused by generally presents milder symptoms and a lower risk of complications. Geographically, typhoid fever is more prevalent in developing countries with limited sanitation infrastructure. Paratyphoid fever, while also more common in these regions, has a broader distribution and can occur in developed countries. Typhoid fever typically progresses through stages, each with characteristic symptoms. Understanding these stages is crucial for timely diagnosis and treatment. The first week is marked by a gradually increasing fever, often reaching 103 to 104 degrees Fahrenheit or 39 to 40 degrees Celsius. Headache, fatigue, and muscle aches are common. Some experience a dry cough or abdominal discomfort. In the second week, the fever remains high and other symptoms intensify. A rash of flat, rose-colored spots may appear on the chest and abdomen. Diarrhea or constipation, abdominal pain, and weakness are common. Section 5. Unmasking typhoid from symptoms to confirmation. Diagnosing typhoid fever involves a combination of clinical evaluation and laboratory testing. Doctors consider the patient's symptoms, medical history, and potential exposure to contaminated food or water. Physical examination focuses on detecting characteristic signs like fever, rash, and an enlarged spleen or liver. However, these signs can be subtle, especially in the early stages. Laboratory tests are crucial for confirming the diagnosis. Blood cultures are the gold standard as they can isolate from the bloodstream. Other tests include stool and urine cultures and serological tests that detect antibodies against the bacteria. Section 6. Combating typhoid treatment and care strategies. Managing typhoid fever involves a multi-pronged approach, including antimicrobial therapy, supportive care, and addressing complications. Early diagnosis and prompt treatment are vital for a positive outcome. Antibiotics are the cornerstone of treatment, targeting and eliminating the bacteria. The choice of antibiotic depends on local resistance patterns and the patient's overall health. Supportive care is equally important. This includes rest, hydration through oral or intravenous fluids, and medications to manage fever and pain. Addressing complications like intestinal bleeding or perforation may require surgical intervention. Section 7. Prevention is key safeguarding against typhoid. Typhoid fever is a serious illness that can be life-threatening if not properly addressed. Preventing typhoid fever requires a comprehensive approach that includes vaccination, improved sanitation, and hygiene education. These steps are essential in communities where typhoid is prevalent. These measures are crucial for breaking the chain of transmission. By implementing these strategies, we can significantly reduce the incidence of typhoid fever. Vaccination is a powerful tool. Two types of vaccines are available, an injectable vaccine and an oral vaccine. Both vaccines have been proven effective in preventing typhoid fever. Both offer protection against typhoid fever, but the recommended vaccine and schedule may vary depending on individual factors such as age, health status, and travel plans. Improving sanitation and hygiene practices is paramount. This includes ensuring that sewage is properly disposed of and that communities have access to clean water. This involves access to clean water, safe food handling practices, and proper sewage disposal. Educating communities about these practices can make a significant difference. Hand washing with soap and water, especially before eating or preparing food, is crucial. Regular hand washing can prevent the spread of many infectious diseases, including typhoid fever. Section 8. A call to action, eliminating typhoid one step at a time. Typhoid fever remains a significant public health challenge, particularly in resource-limited settings where access to clean water and sanitation is limited. Combating this disease requires a global effort to improve sanitation, increase vaccine coverage, and ensure access to healthcare. These efforts must be coordinated and sustained to make a lasting impact. Antibiotic resistance is a growing concern that complicates treatment efforts. The emergence of drug-resistant strains underscores the importance of prudent antibiotic use and the development of new therapeutic options. Research and innovation in this area are critical to staying ahead of resistant strains. Improving access to healthcare is essential for early diagnosis and treatment. Early intervention can significantly reduce the severity and spread of the disease. Strengthening healthcare infrastructure, training healthcare workers, and raising awareness about typhoid fever are crucial steps in the fight against this preventable disease. Community engagement and education play vital roles in prevention and control efforts.